Hello, my name is Faye Holmes. I am going to do my medication administration. So first I have three orders for Millie Larson, date of birth 1/1/1936. Medical record is 123456. Today's date is 6/25/2023. I'm going to check her allergies, which shows on the MAR. She has no known allergies. I have my medication record, and this is my medication administration record, my MAR, the only thing that I have in front of me. So there's three orders. The first order is haloperidol, and that's 2 mg intramuscular, and that's for agitation. I have insulin, 10 units, sub-Q with breakfast, and that's to control the blood sugar. And I also have Docusate, which is 100 milligrams oral tab, and that's given by mouth, and that is for stool softener. All right, so I am going to perform hand hygiene to clean my hands. I am going to don a pair of gloves as well. And then I'm going to get ready to check the expiration dates on all of the medication and begin preparing right after I check the expiration dates. So starting with my oral med, I have the Docusate 100 milligram. It expires on 10/21. I'm going to place that in my medicine cup. And then I have the insulin, Lispro, and that expires on 7/20/31. And then haloperidol, and that expired on 3/27. And I'm also going to check my needle expiration date. And this is my insulin needle, and that expires 11/27 and 12/27. All right. Expiration date. I have gathered all of my supplies. I have my gauze, alcohol pads, my medication cup, syringes, the medication, biohazard, hygiene, my tape, labels, my gloves, and my MAR. So now I am going to draw up my medication and check the MAR, make sure that I have the right dosage. So I'm going to start with my insulin. So first I will clean the top of both. Remove. All right. Alcohol pads. And then next, I will draw up. So I'm going to discard that. My needles. Give it a little shove. Come on. It's always hard to let this go a little bit. All right. So I have my insulin. I'll be drawing up 10 units of Lispro. So first, let's pull back to 10 units. So we can remove the air. Okay. Using the scoop method, I am going to scoop up into my needle, safety. There we go. And then I'm going to remove this needle from the packaging. I'm going to connect my needle, syringe, and this is for the haloperidol, and I will be drawing up 0.4 mLs for 2 milligrams. It is a 5 milligram vial per ml, and so I can remove this top. They're so hard to take off, but safety wise, I've already cleaned the top. Oh, all right. And there. There we go. Place that back here. And then again, using the scoop method, I am going to attach my needle back. So I need to label both. So I am labeling my haloperidol 2 milligrams. Put the label on that. And then I will label my 10 units of insulin. And I am just going to place a small label on my cup. All right, so I have my 100 milligram of DocuSate, 10 units of insulin, 2 milligrams of haloperidol. I have prepared all of that. I am now going to remove my gloves and I'm going to head to the patient's room. All right, knock, knock, knock. Hi, Miss Millie. This is Faye Holmes. I'm sorry. Hi, Miss Millie. I am Faye Holmes, and I am here to administer your medication. I have 3 medications, but first, can I get your last and first and last name? This is Millie. She said Millie Larson. Your date of birth? 1/1/1936. I checked her armband for a second identifier, and she is who she says she is. So, Millie, I did clean my hands, but I'm going to do it again. And then I'm going to don my gloves and administer your medication. And I checked, it said that you had no known allergies. Is that correct? Great. All right. And do you prefer to have your insulin, administer your insulin site? Do you prefer site? I'm sorry. Okay. I'll use your left lower quadrant. And first I'm going to start by giving you your oral meds. So cup of water, I'm going to give her 100 milligram of DocuSate by mouth. All right. You took that without complications with water to follow. All right. And then next, I am going to administer your 10 units of insulin to your lower left quadrant, your abdomen, and you're about to have breakfast. So this is for your blood sugar. This will help control it. I'm going to remove my needle. 10 units. I'm sorry. I have to put that. I'm going to use the scoop method to recap, only because I took it off too soon. And I'm going to clean her site, which is her lower left quadrant. All right, toss that. All right, allow it to dry. Now I can remove. All right, again, 10 units. I am going to squeeze and pinch, squeeze, pull up her skin. All right, and then I'm going to administer and slowly inject her medications, remove, and activate my safety device, and dispose in the biohazard. Good job. I'm going to take my gauze and just dab it. She have a little bit of blood there. Are you okay? All right. So next I'm going to administer your haloperidol injection in your thigh. So I'm going to use your right thigh, if that's okay. All right. I need an alcohol pad. There we go. And then in the alcohol pad, I'm going to clean, with the alcohol pad, I'm going to clean that site till God's ready. Allow it to dry. I have haloperidol, 2 milligrams, which is 0.4 mLs. All right, I'm going to remove the top. I'm going to spread your skin a little tight. There we go, tight. And then I am going to inject and slowly administer your medication. Good job. And then remove. I am going to activate safety device. Immediately dispose. Got a little blood, so now I am going to apply pressure to stop. Any questions? How are you feeling? Are you okay? All right, Miss Millie. So that is all your medications. You had only 3 for this administration, and that will be it. And I will be out of your hair. I am going to remove my gloves, clean my area, perform hand hygiene. I'm going to make sure Miss Millie is comfortable in the bed, give her her call bell, make sure her bed is at a safe level, and ask her if she needs anything. And that concludes my medication administration. Thank you. Have a great day.